Hi, I'm Jacob Pham, and I'm doing an in-service on caring for those with intergenerational trauma. First and foremost, I'd like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. Health is a universal need, not a want. It is the fundamentals of health that allows us as humans to thrive, and unfortunately, it is the various factors in everyday lives that inevitably change the course of health outcomes. This has severely affected the Aboriginal and Torres Strait Islander community. Unfortunately, that's the reality of health situations they face. Despite the measures placed in order to counteract the various factors affecting their health, according to an article by Gracie in 2019, a variety of mismanagement and financial situations by the government clearly contributed to the failure, and more specifically, the difficulties in recruiting trained staff in these remote areas. This is just a small piece of the puzzle. There are many more disadvantages affecting communities nationwide, with which affects the social determinants of health, education, housing, and employment, in which major factors ultimately causing a reaction to the health and well-being disadvantages experienced by the Indigenous Australians. With statistics by Crane and co-researchers in 2024, the males in fatherhood who provided an answer what they personally seek in order to help guide their children's future. There were five common themes that were highlighted, which 21% seek money or financial issues, or face financial issues. 17% seek social and support services. 14% seek housing. 12% seek more time spent with their kids. So 12% seek more time with their children. 9% seek life skills and education, while 27% all had a different answer, in contrast to the major themes presented. It just shows that the social determinants of health is a factor to consider, and that it's not that they have failed themselves, but the government, but the system failed them. Trauma is a common theme that is a negative human experience, and depending on the situation, it can also evolve into post-traumatic stress disorder, which is something highly likely to have been diagnosed amongst the Aboriginal and Torres Strait Islander community. This cumulative fear has been passed down for generations, hence the name intergenerational trauma. This fear factor leads to uncertainty to the health system, inducing paranoia, disbelief, suspicion, and mistrust. With a study by Men- Menzies in 2019, they sorry, with a study by Menzies in 2019, they explain PTSD as an experiences. Sorry, with a study by Menzies in 2019, they explain PTSD as experiences that display vivid flashbacks of moments of hopelessness and intense anxiety. The disorder interrelates to the intergenerational trauma as stories passed down by elders who have experienced the stolen generation would repel the healthcare provided, hence the next generation and so forth. Aboriginal interpreters have acted in both worlds, as in the shoes of the patient and healthcare professional. According to a study by Mithens and colleagues in 2021, they had interpreters elaborate that positive experiences derive from from experience in training, which healthcare's healthcare providers lack, and I felt a lack of respect. It shows that the implementation of programs to mentor the healthcare professionals are needed to ensure patient-centered care is received. A study from the Australian Institute of Health, a psychological distress survey was conducted from 2018 to 19 to establish severities from to low, low moderate, low to moderate, and high and very high. Males typically had 69.7% with low moderate, with 25.8% high and very high. In contrast to with females with 62.8% high, sorry, 62.8% low and moderate, and 35.1% high and very high. And with the age group with the lowest low moderate range was 25 to 34 years with 67.1%, and highest and very high was 45 to 54 years experience with 33.3%. Nurses and midwifery roles in handling intergenerational trauma reflects of patient-centered care and cult being culturally safe. And being culturally safe to build the trust they have lost with the healthcare system. To have a better understanding of treating patients with intergenerational trauma is disclosed in an article by Campbell and colleagues in 2019, who mentions to specifically to improve four key factors: awareness, safe recognition, assessment, and support. Awareness allows us to understand the severity of the trauma, sorry, understand the severity of the trauma as well as understand how to comprehend the issues. Safe recognition allows us to identify the support needed, minimizing the risk of causing psychological effects to occur. Assessment allow us to conduct and recognize the underlying complex psychological distress. Support is what nurses and midwives are all about, which is to adapt to provide emotional, psychological, cultural, and physical needs. All these four factors discussed are clear that it would promote the safe environment the Aboriginal and Torres Strait Islander community needed, and the need to seek, sorry, and the professionalism they deserve to, so I repeat that. All these four factors discussed are clear that it would promote the safe environment the Aboriginal and Torres Strait Islander community needed and the professionalism they deserve. To further advocate for key elements in the role of nursing dealing with intergenerational trauma, and that is to be culturally safe. As understanding the origins of Aboriginal and Torres Strait Islanders and the history of colonization. It would help eliminate major biased assumptions and further develop the therapeutical relationship to provide holistic care. How to be culturally safe. It is achievable through the consideration and use of self-awareness, proactivity, leadership, responsibility, and accountability. This, the reality is many many people lack cultural understanding of any cultures, both foreign or domestic. Hence why both foreign and domestic. Hence why holistic care is difficult. That is why, as nurses, we develop passion and empathy in a way that displays a path of understanding to all. In order to develop three realistic fundamental skills, according to the Center for Aboriginal Health in 2024, highlights these strategic priorities 2.3 person-centered care, which demonstrates the need for tailored care, which opens opportunities for Aboriginal and Torres Strait Islander people to resonate with the nurses to create a trusting therapeutic relationship. Strategic priority 3.2, which is to understand social and emotional well-being and trauma-informed approaches, which strengthens the interpretation of long history that created negative health deriving from the battles of intergenerational trauma that would allow us to adjust appropriate services while enforcing the culturally safe practices. Strategic priority 4.1, social determinants of health, which are essential to develop and strengthen knowledge of their health choices, which reflecting of the health system, which is implemented through Aboriginal and Torres Strait Islander people to ensure community priorities. Sorry, Aboriginal and Torres Strait Islander people and elders to ensure community priorities are met. Another strategy is utilizing qualified interpreters, as without proper understanding, it leads to a more difficult situation, not giving full the full care provided. These strategic these strategic key factors help increase positive health outcomes and a better understanding and treating the Aboriginal and Torres Strait Islander with intergenerational trauma, providing culturally holistic care. Now, the take-home message is to utilize the strategic strategies mentioned, be open-minded by expanding your knowledge, be culturally safe, and most importantly is the key to developing any therapeutic relationship is utilizing person-centered care. Thank you for listening.